How to avoid annoying tonsil stones. Simple prevention tips. Tonsil stones are one of the most annoying and uncomfortable experiences of all. They can cause a foul odor, a bad taste in your mouth, and even pain. Fortunately, there are a few simple prevention tips you can follow to avoid getting tonsil stones. By taking a few simple steps, you can avoid the uncomfortable experience of having tonsil stones and the associated odor and taste. This video will provide you with some tips on how to prevent tonsil stones and keep them at bay. Watch on to learn more about how to avoid those annoying tonsil stones and make sure you never have to deal with them again. What are tonsil stones and why do they occur? Tonsil stones, also known as tonsilloliths, are small, hard lumps that can form in the crevices of the tonsils. They are usually made up of food particles, bacteria, and other debris that get stuck in the crevices of the tonsils and harden over time. These stones can cause a range of symptoms including bad breath, a metallic taste in the mouth, and even pain when eating or swallowing. Tonsil stones can be caused by poor oral hygiene, allergies, or even genetics. How to identify tonsil stones? In order to identify tonsil stones, you should take a look in the mirror and examine the back of your throat and your tonsils. If you see any white or yellowish lumps, these could be tonsil stones. You may also be able to feel them with your tongue. If you do feel any lumps, you should see your doctor to have them examined and properly diagnosed. Symptoms of tonsil stones. The most common symptom of tonsil stones is bad breath. This is due to the bacteria that can get trapped in the crevices of the tonsils and cause a foul odor. You may also notice a metallic taste in your mouth or a feeling of something stuck in your throat. In some cases, tonsil stones can cause pain when eating or swallowing. Causes of tonsil stones. Tonsil stones can be caused by a variety of things, including poor oral hygiene, allergies, or genetics. Poor oral hygiene can lead to food particles, bacteria, and other debris getting trapped in the crevices of the tonsils and hardening over time. Allergies can also cause an overgrowth of bacteria in the tonsils, leading to the formation of tonsil stones. Genetics can also play a role in the formation of tonsil stones, as some people are more prone to forming them than others. How to prevent tonsil stones? Fortunately, there are a few simple steps you can take to help prevent tonsil stones from forming. The first step is to practice good oral hygiene. This means brushing your teeth twice a day and flossing regularly. This will help to remove any food particles or bacteria that could get stuck in the crevices of the tonsils and lead to the formation of tonsil stones. Another important step is to stay hydrated. Drinking plenty of water throughout the day will help to keep the tonsils moist and reduce the risk of food particles or bacteria getting stuck in the crevices. Additionally, avoiding sugary and acidic foods and drinks can help to reduce the risk of tonsil stones, as they can lead to an overgrowth of bacteria in the mouth. Diet to help prevent tonsil stones. There are certain foods that can help to reduce the risk of tonsil stones. These include foods that are high in fiber, such as fruits and vegetables, as well as foods that are rich in probiotics, such as yogurt and miso soup. Eating these types of foods can help to keep the tonsils clean and reduce the risk of tonsil stones. Additionally, avoiding foods that are high in sugar and acidity can also help to reduce the risk of tonsil stones. Ways to reduce the risk of tonsil stones. Aside from practicing good oral hygiene and eating a healthy diet, there are a few other steps you can take to reduce the risk of tonsil stones. For example, quitting smoking and avoiding second-hand smoke can help to reduce the risk of tonsil stones, as smoking can cause an overgrowth of bacteria in the mouth. Additionally, reducing stress can also help to reduce the risk of tonsil stones, as stress can weaken the immune system and make it easier for bacteria to grow in the mouth. Treating tonsil stones. If you already have tonsil stones, there are a few steps you can take to get rid of them. The first step is to see your doctor for a proper diagnosis. They can help to determine the best course of treatment for your specific situation. In some cases, a simple course of antibiotics may be enough to get rid of the stones. However, if the stones are large or painful, your doctor may recommend a procedure such as laser surgery or a tonsillectomy. Home remedies for tonsil stones. In addition to seeing your doctor, there are a few home remedies that you can try to help get rid of tonsil stones. One of the most effective home remedies is salt water gargles. Gargling with warm salt water can help to loosen the stones and reduce inflammation in the throat. Additionally, drinking lemon juice or apple cider vinegar can help to reduce the size of the stones and make them easier to remove. Finally, using a neti pot can help to flush out the tonsils and remove any trapped bacteria or debris. This can help to reduce the risk of tonsil stones forming in the future. Conclusion: tonsil stones can be a very annoying and uncomfortable experience. Fortunately, there are a few simple steps you can take to prevent them. By practicing good oral hygiene, eating a healthy diet, avoiding smoking and second-hand smoke, and reducing stress, you can reduce the risk of tonsil stones. Additionally, if you already have tonsil stones, there are a few home remedies you can try to get rid of them. By following these tips, you can avoid the uncomfortable experience of having tonsil stones and make sure you never have to deal with them again.